So, well, my name is Ahmed, again, and sort of a little bit about me. I got my bachelor's, like Kelly said, in biology and chemistry back in '06 here at UC Irvine. Did my master's in public health with an emphasis in epidemiology at Davis. This presentation is really based on my observation in Gaza and in the Sinai Peninsula. If anyone knows where Gaza is, how many people know where Gaza is on the map? All right. Okay. So this is really based on my interviews with the Gazan Minister of Health and some medical personnel over in the Shifa clinic, a couple of civilians and a couple of soldiers. Also, building on the work of my colleagues, as well as reports of UN groups and NGOs in the area. So the objective of this presentation really is to underscore the unique challenges that public health faces in the siege environment, which is really different from a wartime environment, certainly a disaster environment. The second is sort of use Gaza as a model for the events that happen under siege, and usually we see the starkest and we learn the most from extreme examples. Examples where all the factors are just right, or in the case of Gaza, just wrong, to produce this disaster. The third is to identify the critical role that public health professionals, you guys, play in that scenario, right? Hopefully open maybe some career paths and choices for you as you continue finishing your degree. Then we're going to discuss some possible reforms for how the public health assessment system or the machine really works in these situations. And then finally, doing all this while still keeping you sort of awake and alert and engaged. If you have any questions, just please feel free to interrupt. This presentation is not to discuss Middle Eastern politics. This issue is very passionate, and it means a lot to different people. So, politics off to the side. This is also not to discuss the legitimacy of any groups, right? We're not going to talk about who's wrong and what Israel did and what Hamas did and what Fatah did and what any other group might have been implicated with. It's also not to propose a solution for the Gaza Strip. I mean, we only have an hour and a half maybe, but not an hour. It's also not to represent anyone else's perspectives but my own, right? And finally, this is not about me going off to faraway lands, giving a presentation about my adventures, complete with clearly doctored photos of me doing heroic actions. Okay, maybe just this once. This is me saving a child in Haiti. Clearly, see the guy's shocked and surprised. The siege, denotationally defined, is a military or economic blockade of a city or territory. It is characterized by constant work, relatively low intensity of military action, and usually one side maintains a strong and static defensive position against the other. Siege is really very, very old. It predates the establishment of cities, if you can believe that. I guess you can lay siege to a cave, you can lay siege to a valley, but certainly the records that go back from antiquity tell us that siege is something that's as old as human civilization itself. So let's go over some very recent sieges. And then we'll draw some comparisons and contrasts between what an economic siege is and what a military siege is, right? In 1982, Israel, while routing PLO forces, laid siege to Beirut. That took around 2.5 months, 2.3 months. In 1992, Serbian paramilitary forces laid siege to Sarajevo. That lasted 4 years. In 2004, Fallujah, which sort of became the focus of anti-US activity in Iraq, was besieged for about a month. And recently, and that's sort of the big piece of news back in '09, was that the 30-year-old militia that's known as the Tamil Tigers were finally sort of deposed by General Rajapaksa and his efforts into northern Sri Lanka. Now, you notice all of these are very short when compared to economic sieges. In 1986, South Africa being declared an apartheid state, began taking sanctions from the United Nations, and that's really one of the few sanctions that have actually worked. I mean, correct me if I'm wrong, I see some people from international studies here. Of course, sanctions during the first Gulf War lasted 12 years, the one in Burma, 13, and then recently the one in Zimbabwe, 9 years, all of which are currently still active, with the exception of South Africa, with the destruction of the apartheid. So, a military siege is really very straightforward, right? It causes damage to public resources and activities, causes destruction of existing infrastructure for the city. Largely, the damage is mass trauma and injured civilians, property loss certainly, but it's typically short, acute bursts of events with a high number of casualties and injuries. On the other hand, the economic siege tends to be disruptive when it comes to imports and exports of the region in question, right? It disrupts the maintenance of the existing infrastructure. So anything that's coming from the outside to keep that system up is largely stopped. Material scarcity and rising costs is usually one of the byproducts. A lack of confidence from foreign investment is also another very potent result. And a typical period is much longer than a military siege. But the two, however, as far as we public health people are concerned, is a threat to the top 10 achievements in public health, right? And introduces new disease burdens in the population. Of course, we all know what the top achievements in public health are, right? Can anyone sound them off?
No smoking.
No smoking, that's one of them, right? Anything else? Clean water and sanitation, right?
Eradication of
Infectious disease, yes. Very good. Vaccinations, right?
Lead.
Lead, that's another one. Fluoridation of water, recently, right? So these things have really contributed to the longevity of life that we enjoy today. Back in the 1900s, what was the average lifespan? 48 years. Now it's what, 78? So a significant bump. You take that away from the people, and then you can sort of understand the scope of the disaster that hits the area. So what makes Gaza a unique model, right? Actually, Gaza is actually very, very unique, almost unprecedented. It's the only region in the world, at least that I know of, where there's a civil war, a regional war, and a national war. So Gaza is undergoing a civil war inside of itself because of fringe groups. It's at war with a regional counterpart, which is Fatah, and it's also at war with Israel. So it's very, very complicated. Gaza remains under both regional and international sanctions, so that's another layer of complexity. It's under heavy land and maritime blockade by Israel, I think since June of 2007, right? I'm correct. It's also one of the few places in the world that's undergone a heavy military campaign, followed by a siege, followed by a heavy military campaign, and then another siege. So it's just constant choking of that one landmass. It's also one of the few regions in the world where certain factors are at play in terms of water supply and food supply, and the contamination of the agricultural sector that is sort of on the brink of a disaster that may be, in many cases, irreversible. I'll discuss that later. Let's just look at sort of the city, or the strip. It's about 41 kilometers long from the south, what's this? It's east? No, it's west. Southwest coast of Egypt to the northeast coast of Israel over where Erez is. It's about twice the size of Irvine, right? It has about 1.5 million residents as of July of 2009. 85% of these residents are refugees from previous wars. And that's a major number. The density is 2.25, which makes it the 6th most densest population in the world. 80% of the Gazans currently live under the poverty line, which means they live under $1 a day. And like I mentioned earlier, the siege of Gaza began in 2007, when Hamas more or less consolidated power.
What's the biggest concentration of people amongst the cities?
The south. The south has the highest concentration, especially areas of Khan Yunis and Rafah. this tends to be largely agricultural land. Almost, you can think of this as the San Joaquin Valley, almost. And then the density goes back up when you reach these areas. Although because of the groves and the farms is a bit more sparse than this, but certainly a bulk of the population live here, simply because it's next to Egypt. A lot of assistance there. So, if you want to evaluate the healthcare sector in Gaza before Operation Cast Lead, by the Operation Cast Lead is the military campaign by Israel in the Gazan territories. So, it was the Israeli policies of cordoning and incursions, one, and two, Palestinian policies and divisions. These are the two factors at play that sort of led to the predicament that is the healthcare system of Gaza. Over here you see tanks amassing the border ready for incursion, and here you see the fights that happen daily in the streets between Gaza and Fatah militia. So, the Israeli policies really restricted the movement of patients and medical resources. So, as we know, we need primary healthcare facilities, right? If we need more help, secondary, tertiary if we need something like surgery. And if it's overburdened, then the Gazans send their people outside, either Saudi Arabia, Egypt, Jordan, for treatment. But since the siege, they've been more or less unable to move anywhere. The people already inside, the medical professionals, don't have access to the training, and if they need new personnel, they're recruiting new personnel, they can't do that because they need the training and it's not present currently in Gaza. Which is, I think, an emerging need for telemedicine, right? You guys want to do telemedicine? Because of the poverty line, the increasing poverty in the Gazan population, the Gazan government was sort of compelled to, well, the Palestinian Authority was compelled to make a free of charge healthcare system, which again burdened the healthcare system because now there's no funding. Now they have to get funding from either NGOs or from private donors in the Middle East or government donors in surrounding countries. Also, the military actions against civilians and infrastructure really overburdened the system. So you have military incursions happening on a daily basis into farms, into houses, the bulldozing of houses, aerial attacks, and then aerial vehicles attacking certain targets which produce human casualty, which ultimately overburden the system. Especially when you move directly from a healthy individual to someone who needs tertiary care. So that overburdens the system quite significantly. Where's the bulk of the cost in any healthcare system? The tertiary services, right? So that's where you need the ICU, that's where you need the surgeries, that's where you need a lot of the specialized equipment to keep that person alive, right? Palestinian division wasn't too helpful either. Back in 2007, Hamas won the popular vote in the Palestinian territories, but a lot of their support was in Gaza. So there was this period of duplicity where Hamas sort of felt like it administrated the region, but of course the Palestinian Authority was the official head. So there was this sort of duplicity of powers. You had healthcare workers have their budgets slashed, their salaries cut as sort of a punishment to Gaza by the Palestinian Authority. So really it's a fight between two groups, and the one paying the price are the actual workers. Because of this strike, this budget cut, a lot of them started striking. And when the strike occurred, then there were detentions, tortures, and human rights violations by the Palestinian Authority and Hamas against workers in Gaza. That led to heavy security presence in healthcare facilities, which again sort of drove a lot of people away from seeking services. It finally reached a crescendo when Hamas just blatantly took over the rest of the Gaza Strip. Of course, that produced significant deaths and injuries, near collapse of the police and paramedic services because the two are very much intertwined in the country. The ministry, now that it sort of had loyalty to Hamas, sort of kicked out all the people from the PA who were experienced and replaced them with Hamas loyalists who were not necessarily experienced in what they were doing and didn't have a clear health plan for administering health and safety in the region. And then comes Operation Castlight, right? So this, for whatever reason, I'm not going to discuss the politics, but Israel decided to embark on a major land, maritime, and air campaign against Gaza. And it really started with just heavy airstrikes. I think it was 100 tons of explosives were tossed on the Gaza Strip within the first, 9 hours? 100 tons, a lot of them concentrated on the border of Egypt and Gaza, so sort of at the Rafah border. And the reasoning behind that is that's where a lot of the tunnels were. So if you attacked this area first, then you can cordon off the rest of the area for targeted operations and stop any flow of weapons during the campaign. That was one. Following that, you had both coordinated artillery and naval strikes. So you had Navy, Israeli warships over where North Gaza and Gaza is, as far south as Deir al-Balah, attacking these regions. At the same time, you had the artillery, especially over in the Rajah Crossing, Kisufim, and as far south as the Rafah border, basically pummeling specific targets. Of course, in lieu of all this was the pending ground invasion, which basically came here and sort of split Gaza into two. They wanted to cordon off the south so they can be able to take care of the rest of the north. Because again, there's one route that goes throughout this whole strip, and that's the main sort of supply line for anything going up and down Gaza. So that happened for around, I think, 9 days. Once they were sure that all the targets have been quote unquote softened, then they sent in the infantry. So the infantry, again, marched through the Kisufim crossing, stopped, and then paratroopers were placed both in Gaza and in Khan Yunis. They stayed until the offensive was launched and they rejoined their groups. Be that as it may. The numbers that you see are sort of the number of deaths of people, number of which were women and children, number of injuries. And this is sort of the number of strikes per kilometer squared. So you can tell that a lot of the attacks came in areas of high density, right? So a brief look at the weapons that were being used. I think it's just...
What I read in the newspapers was that these numbers of casualty are disputed.
Right.
So where's the origin of this data?
So the origin of this data comes from the UNRWA. It also comes from, my eyes serve me correctly, the Medical Arab Union, which is an office in Gaza. So, and that's true, the numbers are disputed. But the window is actually quite narrow. So it's between 1221 being the conservative and somewhere around 1500 being the sort of overput. A brief look at the weapons that are being used, and that's really important when it comes to public health because the weapons used sort of tell you what you should be looking for when you start assessing the damage. When it comes to airstrikes, the GBU-39, still, the sort of jury's still out on whether or not it's actually been used, but this actually carries depleted uranium. And if depleted uranium was used in Gaza, then that opens a whole new can of worms. And the other issue in question is the use of white phosphorus shells. These are incendiary devices that sort of spray white phosphorus, which is very volatile when mixed with air. Of course, up until today, they're using the unmanned aerial vehicles, and you can tell that they're there because you hear this distant humming noise somewhere between the sound of a single-engine Cessna and a toy plane. All right, these are some of the pictures that we took while we were there. So this is the Gaza Parliament building. A primary target of the attacks were obviously government installations. This is a petroleum company. So a lot of the infrastructure that was destroyed really was water and power. So the petroleum company was destroyed. The cement company that was destroyed. And some of the water treatment plants were also struck. And the idea behind that is, well, if you hit the cement and the energy comes, that stops the building of tunnels and so on and so forth. UN vehicles were also targeted. As you see, this vehicle was struck with tank machine gun fire. This is a food storage that was struck with, I think it was an artillery shell. So this is just one of the bags of, food that was sort of recovered from the wreckage. This actually comes from France, and I think it's a bale of sugar. So one of the other targets in Operation Cast Lead were the hospitals. And I'll tell you the level of destruction later, but you can see that this is sort of the emergency wing of the hospital struck with, I think, also an artillery shell. This is the American school, the American International School in Gaza. That too was destroyed, but this was destroyed by a missile coming from the sea. And thankfully it was struck when school was up, so the damage wasn't too huge. Mosques were also struck. Most of the minarets were usually targeted because, according to Israel, this is what they use for launching the missiles. So, really, it was just a blanket attack. And because of the blockade, the UN announced that this is really one of the few places in the world where you really have nowhere to go. Iraq, you could have escaped. Afghanistan, you could have escaped. But here, just because of the geography and the sheer control over the region, it was very difficult to be safe anywhere. So this is the numbers that are coming from the United Nations, just to be accurate. 31% of deaths were children, 8% were women, 61% were men. Of the injured, the numbers are quite similar. And stemming from that, around 100,000 people became newly displaced. The number is sort of shocking to the fact-finding mission because Israel says that it has a lot of precision-guided weapons, and they do. You look at the profiles of their missiles and their operations, and they seem very, very surgical almost. And yet, you come up with these really gross numbers. I mean, nearly half of the casualties were women and children who are, by UN regulations, non-combatants. And that's not mentioning those of the men who were non-combatants as well. In terms of damage to the health system, so there are around 110 clinics in Gaza, 43 of which were destroyed. 15 of Gaza's 21 hospitals were destroyed, and 29 out of the 148 ambulance vehicles were destroyed. When I sat down with the minister, his niece came up and told me that her brother, so they were raised in Germany, and they came back during the war. They came back to help with the relief effort. One of the 29 ambulance vehicles that were, shuttling the injured to and from were struck with one of those artillery shells, and her brother died, and that's that vehicle. So it's very, very compelling to see just the impact of the war on people who are actually just there to help. 16 health workers were killed during that operation, and 25 have been injured on duty. So, during my interview with Dr. Besson, he said that currently 85% of the health services are administered directly by the Ministry of Health, right? 15% of them are NGOs. It used to be much higher, but because of the war, a lot of NGOs had to pull out. One of the things that happened when Hamas took over is that they also took over some of the NGOs to sort of nationalize them, if you choose to use that term. Currently, there are 55 primary health centers, 12 hospitals, and 2 tertiary health centers, which is more or less half of what they had to begin with. Of course, the numbers that you see here are the ones that people always think about, right? They always think about what's the trauma to the population, what's the acute effect, right? So the estimation was, and this is from the head of Chifa Clinic, which is one of the tertiary hospitals located in the north, around 6,000 people will die from direct or indirect causes of the conflict. 500,000 will be adversely affected in some way. There is the enduring disabilities, so people that have lost limbs, people that have suffered neurological trauma, and so on and so forth. Food and waterborne outbreaks because of the lack of sanitation and so on. But one of the things that she did mention, and she kept repeating over and over, is the high number of miscarriages that she's seen. Around 3,500 births took place during the 3-week war in Gaza, which attests to the high fertility rate of the area. But a lot of them, well, a significantly higher percentage ended up either ending in a miscarriage or higher neonatal death. Right. And one of the things that they also note is an increase in chronic disease such as asthma, COPD, heart disease, but asthma in particular. And of course, the psychological trauma, PTSD, and unipolar depression. Unipolar depression she cites to be primarily because of the really, really high unemployment rate. In Gaza, you either work for two groups. You either work for Hamas or you work with the relief effort. And there's very little else in between, other than the merchants.
There has been some attempt to correlate the use of depleted uranium with birth defects. Did she mention that in the miscarriage?
No.
No, it's not.
But actually, the head of Al-Shifa did when I spoke with him. He seemed to be the more aware of depleted uranium. She spoke mostly about the white phosphorus, because that's the thing that you see on the all right, so this is where sort of the UN and the NGOs and the public health people sort of split, right? The UN is interested in deaths from injuries, impacts of lack of access to health services, chronic diseases, and so on. As well done as their reports are about the environment, they gloss over the reasons behind the chronic diseases, and they ignore the lasting and the potential for the emergence of chronic diseases, as well as environmental damage. Really, what I would like to characterize their epidemiology is really passive epidemiology, because they come in with the same questions for every region. They say, okay, what happened? And they test for the same things. I was reading the report by the environmental wing of the United Nations, and they didn't test for uranium for some reason, despite the fact that there were a lot of suspicions that depleted uranium had been used. And that sort of paradigm was the same one that they used back in the north of Sri Lanka. Now, the Sri Lankan army doesn't have depleted uranium, but the Israeli army does. So you really have to make a full assessment and know exactly what you're walking into to be able to measure everything that's needed. From the broader health perspective, I was thinking about what the built environment now looks like. What is the status of the environmental health? What are the specific epidemiological questions that we have to ask, right? And from the recommendations, these recommendations need to be relevant. So we can't say, oh, break the siege. It's not something that you can do. Certainly it's not something the UN can do. But you have to make recommendations that can be done on the ground and immediately. So, going back to the top 10 achievements of public health. Environmental contamination, water resources, food resources, the built environment, these are all factors that have contributed to more or less the doubling of the life expectancy of Americans back from the 1900s all the way to the end of this past century and beyond. So when you take away these things, those fundamental things, this is where you expect the human loss to be the most. Not from, as damaging as they are, the military action, and not from the injuries, but really from the infrastructure that you've taken away from people. Now you've brought them back to the 1900s. So going back to depleted uranium, and I mentioned this first because it has implications in all the things I just mentioned. They're suspected to have been used, okay? And the only reason why they're suspected is because the cadavers and the victims had a high radioactive count. You put a Geiger counter to some of their tissue, and it goes through the roof. That's usually an indication of depleted uranium. The only other possibility that these missiles might have carried is tungsten. The reason why depleted uranium is used in the beginning, and this is a depleted uranium head being fired on around, I think it's 3 feet of steel reinforced concrete, is because it has a high penetration power. And that's something that you use to bust a bunker or bust a tunnel. And you can see just the penetrance of this missile, and it destroys even the structure from the inside. So it seems to make sense that they would use a weapon like this, especially because we also know that Israel bought 1,000 of these from Boeing right before the war. And these missiles are mounted only during an air campaign. And if you look at the density of where these air campaigns were done, i.e. the Rafah-Egypt border, and the emergence of cancer incidences in eastern Khan Yunis, it becomes evident that there is depleted uranium in the area. And if that's the case, then it makes a world of difference.
Yeah, Ahmed.
Yes.
I hate to admit this, but I used to work for aerospace, and my husband was in charge of manufacturing these depleted uranium bombs. Excuse me. And I know that they would do the testing in Chino Hills with the DU bombs, and then they would dig up the dirt and ship the radioactive dirt up to Washington State. But he did say they were used strictly as armor piercing, so I guess the DU just goes through it like butter.
Exactly.
So.
Exactly. I mean, the depleted uranium was first developed back in the 1970s by the Pentagon. And it was first deployed in the First Gulf War because the Iraqis were using Russian tanks with thick armor. The only way you can pierce through this armor is if you have something that is denser, heavier, and that can pierce with a small enough diameter, i.e. depleted uranium. Again, tungsten is the other option that might have been used, but tungsten is not radioactive. A. B. Tungsten is carcinogenic. Either way, you have leaching into the water sources, the land sources, the air, in very fine nanoparticles, which no N95, by the way, could filter. And the half-life is what? A couple of billion years. So it makes a huge difference. Anyway, can you just move on? Any other questions? Yes?
You're very selective in your choice of wording, and you said they're suspected, it's suspected by whom?
So there's,
identified by whom, it seems very vague and very...
yeah, so this was, right, let me go back to this source. So this was a study published by Action of Citizens for the Total Dismantling of Nukes. This is a group,
Speak up louder, I can't hear you.
yeah, sorry, it's the, so the group's name is Action of Citizens for the Total Dismantling of Nukes. This was a group out of France who visited the Gaza Strip recently with a French delegation, and this was performed in 2008. This is performed in 2008, sorry.
2008.
Right. I'm sorry, the
And
2009.
when was the war?
2009, sorry. Just,
Are there dates correlated?
yeah, right there. So this was the 18th of January of 2009.
There's already been seen a high incidence of cancer in
Right.
one
In
year.
Khan Yunis, right. Which is sort of further north from the strip. Okay. And this was also, just to answer your question, this was also confirmed by the head of Shifa Clinic, who did find the elevated radiation levels in the patients and in the cadavers as well.
Do you know if there's been like a study done on the various like water quality in different parts of like Gaza and radioactivity and carcinogens?
There has been, but the studies didn't mention any radioactivity.
What about carcinogens? Did they see a lot in different
They
parts?
saw a couple of things. They saw a high amount of hydrocarbons.
Mhm.
They also found a large amount of nitrates, but nitrates come from depletion, so it's present in the aquifers anyway. They also found a high amount of tungsten as well.
Did they see any correlation with that and like
The epi studies are really, really lacking at this point. And that's one of the things that the minister pointed out. He says they just don't have the expertise that some of you might provide one day in assessing the damage. Okay? So, just to move along here. The next question is the water sources and the treatment plants. Now, the Gaza Strip is separated into 5 governorates, and each of these are served by either 1 or 2 water treatment plants. If you look at the numbers, though, for the people served by these water plants, you can tell that the numbers are very low. The highest is being 65%. So 65% of Rafah, for instance, has access to a sewage system. the biggest problem is in each of these six sites, you have water leaking, sewage water leaking straight into the Mediterranean Sea. And that causes a compounded problem. First of all, the water being dumped into the sea comes from aquifers. Okay? And as the occupancy level of Gaza increases, you're not getting any of this water back because you're not recycling it. And the aquifers are being depleted, right? So you're not getting any of the water back again. That's number one. Number two, because it's untreated sewage, it goes into the Mediterranean Sea, it contaminates the resources, mainly fish. To sort of compound that, right, so and the other issue is, of course, is you have sewage leaking into the streets because of either backed up piping, because it's not being maintained, or because of pipelines that have been attacked. But the Israeli military also imposes distance curfews on fishing ships. So one day it's 1 kilometer, another day it's 2 kilometers, they think they switch. But that ensures that you get the most contaminated fish, right? Because you're fishing in areas that have the highest amount of pollutants. So the image that I want to show you is really, the image in purple is really the concentration of coastal aquifers for Gaza. This is sort of the strata of any aquifer. Right now, the Gazans are somewhere around here, which means that the water is salty. It has a high amount of nitrates. And nitrates for children is very hazardous. Why? Anyone heard of blue baby syndrome? Right?
That's the hemoglobin level.
Exactly. So, in 5 years' time, it's projected that the aquifers will completely dry up, unless the infrastructure rebuilds itself, and unless much needed materials can come into the city or come into the region to rebuild that infrastructure. All right, food supply. In the study done by the United Nations, there was around 700 impact craters from either artillery or military ships or Navy ships firing missiles into agriculture areas. That has sort of resulted in around 180 greenhouses destroyed. So these are, what greenhouses are. 17% of the total agricultural land completely degraded. And here's one more of these factors that make it very, very dangerous. The Gaza Strip is a desert and more or less arid land, right? It's very ecologically vulnerable, so that unless you keep irrigating the land and you take care of it, desertification happens very rapidly. And once that happens, the amount of resources and money that has to go back in to make it fertile again is immense. So you see, everything is sort of time constrained. That's the condition that you have to work with under a siege. This is a satellite photo of sort of the middle of the strip in Gaza. This is the cultivated land before the war. This is after the war. You can tell that the military sort of built ramparts, and those paths that you see sort of winding around were tanks that drove up and down into the area, completely eroding it.
So the core of the siege was December 2008 to January
Right.
2009. Is there a rainy season? What is the?
I know they've been having droughts lately.
So that's typically not the time when you have a lot of precipitation.
From January to December, I think that would be the time. Right?
Maybe, I don't know.
Yeah.
Like here, if
I mean,
it's Mediterranean, we get the rains during that period. Okay.
Right. And I know right after the war there was a lot of rain. In fact, more rain than they could. Yeah. But right now the drought's actually settling in pretty strongly.
Can you back it up once more?
Sure.
Are these, did you say what the cultivation is before, what kinds of crops, what kinds of?
I'm not sure. I know wheat is one of them, but I'm not sure what the rest is. I know they have a lot of olive trees there.
Right, I was wondering
Off
about all of
orchards.
these.
Yeah. So now let's focus on the built environment, right? At the end of the war, there were around 3,500 homes that have been completely destroyed, 2,800 that have been heavily damaged, and 54,000 that have been lightly damaged. Collectively, this affects around 325,000 civilians. Okay. Now, the effect of housing on the condition of public health is immense, right? It has implications on mental health, perception of security, psychosocial disorders, social bonds, and the list goes on. Sleep, air quality, hydrothermal control, accidents and injury, malnutrition, and its effect is very relevant to what we're seeing today, which is infectious disease, chronic disease, injury, mental health, child development, and the list goes on. So this is an image of a sort of makeshift house that was established next to the rubble of this one. This is somewhere in the north. One of the children made sure that we'd snap this picture. It's flashing the victory sign. So here's the thing. For, I'd say around 20 years, 20-some years, electricity has been more or less consistent in Gaza. But when electricity is gone, people have to resort to sort of more primitive ways of lighting. In this case, it was a kerosene lamp. But because this child has never really had to use kerosene lamps before, it sort of ended up in an accident for him. And this is something that's seen quite common. These injuries because of having to use resources that have never been used before, certainly more primitive than the ones that they're used to. The case of this child really, with burns over 50% of the body, the doctor told me because of infection that might ensue, the survival is actually very slim. So now, what is the greater context of all of this, right? There is a greater threat to the safety and security of people of Gaza than the immediate damage that we're all seeing and that we all are usually used to seeing. The scope of the damage is not linear, right? Because if the aquifers dry up, if the depleted uranium leaches into the environment, then the longer the siege, the higher the death toll. There's more active, actually we need more active and educated surveillance to be able to see exactly what the scope of damage is. We need to ask the right questions, do the right tests, and come up with pragmatic conclusions. And these decisions need to be advised both to public health professionals in Gaza as well as the ones outside of Gaza that have the resources to be able to make these assessments. So historically, we know sieges to be more leisurely than war. Because back then the weapons weren't as advanced. But public health needs to sort of catch up with the way modern warfare is done, in much of the same way that siege is being done, and to know exactly what the long-lasting risks are and address them. And if this teaches us anything, really, is that economic and military siege is equally lethal. So now the question becomes, is Iraq a predictive model? After all, after Operation Desert Shield, then Operation Desert Storm, and then 10 years of sanctions, more or less, and then the war again, there have been around 1.5 million deaths due to combat, sanctions, disease, and depleted uranium. But admittedly, in their own words, the UN, the WHO, admitted that they hadn't seen the threat until they started seeing the cases, right? So when the cancer rates shot up dramatically, and the sanctions prevented the MRI machines and other medical equipment from coming in, the effect of cancer was too high to ignore the reason, and they did the study and they figured out that it was depleted uranium, among other carcinogens in the soil during the war. And the damage remains lingering today, and the question is, will we as public health professionals catch up with the modern forms of aggression to be able to forecast what the needs are and what the scope of the damage really is? There's two subliminal messages here. Public health is a very broad brush, very broad. And in this topic alone, we've covered, epidemiology, nutrition, public health policy, environmental science. And here's the message that I want to convey to you in a very uncontroversial way. Of course, you're all doing your MPH degrees. Good for you. Keep going. But to me, I feel like an MPH is an accessory degree. And what do I mean by that? I mean that you almost need another skill to be able to push public health with it. I mean, if you're into politics and you have an MPH, that's great. We need a lot of public health reform, right? If you're an engineer, that's excellent. That helps us with the built environment. If you're into law, then you know exactly what violations have been made and who takes the responsibility. Architecture, medicine. So public health is an excellent tool to couple with another skill. Even we on campus as environmental health and safety, we oftentimes find ourselves trying to convince people to do something instead of what we could be doing ourselves. And I'm sure Sheila will vouch for that. So I really encourage you to seek something beyond the MPH, or if you have another skill to forward that with your MPH degree, you'll find that you'll make a lot more advances and will be a lot more satisfying. Last thoughts. Really the sort of the take-home lesson that I took away from Gaza is you have to perform your own assessment under any conditions. You can't take a template and then adapt it to any situation. You have to ask the relevant evidence-based questions, just as you're doing evidence-based public health. You also have to have evidence-based questions. You have to be thorough in your analysis, and you also have to be assertive. I don't know how more assertive anyone can be in the scope of a disaster like this, but as always, politics does trump science. And before I end, I wanted to sort of thank the people of Gaza for their kindness and their hospitality. I know we came in at like 2 o'clock in the morning, and the Boy Scouts of Gaza, of all people, were waiting for us with horns and drums and just a lot of merriment. My colleagues over in the VP Convoy to Gaza, Minister of Health, who gave me a lot of his time and his expertise, Member of Parliament, British Parliament, George Galloway, and the staff at UCI EHS, who sort of made it possible for me to take this time off and do this little expedition. Thank you so much.
And we have your sales pitch for public health on tape, so we'll be using it in our commercials. Are there any questions for Ahmed while he's with us? Yes.
I read a paper about refugee camp conditions once, and I was wondering if you can elaborate a little bit about the conditions of the camps the homeless.
Right, so how they're distributed, they're very sort of small clumps around bigger sort of what we call slum environments. Right? Everything there tends to is communal, right? Electricity is municipal at best. So the way they're designed is that next to every rubble, there's either a camp or there's like a makeshift house. And that's very non-traditional from the camps that are already existing in Gaza. So the ones that exist in Gaza before the war are kind of like these big, they kind of look like trailer parks, but instead of trailer park, they're like tents. And you have a central pump where you get the water, you have designated eating times, and you have like a little, small library or a mosque or something like that. But in the areas that have been destroyed, it's really sparse. So you have your rubble and you have your tent. And that's how it works. Any other question? Go ahead.
Okay. I'm curious, sharing of knowledge between your expedition to Gaza here versus the recent earthquake in Haiti. As far as
that was a doctored photo, by the way. I wasn't in Haiti.
I missed the first few slides.
Okay.
And so maybe you discussed this before a while, but short-term disaster, long-term economic, ecological consequences. Throw in hurricane season rapidly approaching, sea level rise. Is there some sharing of knowledge that can go either way?
That's a really great question. The only foreseeable sharing of knowledge is by people who have been in both places. And really, there are things that are alike, like the chain of resources and so on, and the administration, but there are also things that are radically different. The water sources coming to Haiti are different from the water sources going to Gaza. The food supply profile is also different. And that's part of the reason why I said you sort of have to look at the profile to see where the risks are in performing the SWOT analysis and so on and so forth. But what really helps in sharing of knowledge is reading these really comprehensive UN reports about the state of the environment in Gaza and in Haiti. Those provide excellent tools because, again, they use the same rubric.
Two questions, actually.
Sure.
One has to do with Cuba, which seems sort of off the, Cuba has been under blockade for many years.
Yeah.
Have you done any, has anybody done any research in terms of public health and the Cuban population?
Yeah, that's a great question. I certainly haven't. But I do know it's certainly better than the one in Gaza, for sure, the public health. Now, there's a difference, right? Because not all sieges are alike and not all sanctions are alike. When I mentioned that the South African sanctions were one of the few ones that worked, it's because a lot of the sanctions failed, right? Because not everyone is on board with the sanctions. In Gaza, it's very hard to go around sanctions because you're bordered by Israel, who is the main military power in the region, and you're bordered by Egypt, which is bound by peace agreements to Israel. That's widely different from Cuba, because Cuba has a lot, the same way as North Korea is sort of different than Gaza, because it has strategic allies, China, Iran, countries like that. So it really depends on how the context of the sanctions. So if everyone agrees.
So doesn't Gaza have strategic allies with Iran? Hamas does, certainly.
That I don't know. And it's quite frankly sort of a shadowy issue. No one really knows, A, if they're getting any material support, and B, if they're getting it, how is it happening, and who's involved. That's just politics. I know that they do have moral support from Iran, but how that fits into the whole context of things, sort of a gray area that I don't know about.
So my other half of the question is, have you done any, since we're talking about Gaza specifically, have you done any comparison? Gaza before 67 war was under Egyptian, whatever, I don't know what you call it.
Right.
So they were part of Egypt. Has there been any studies and they were that UN was feeding them and they had a lot of similar public health issues?
Right.
So my question is have you done any comparisons? It seems to me that there would be a really valid comparison to see how was it then and how is it now? How much damage was really just interesting?
Yeah, I think a more telling comparison would be back in 1947 or so, because Gaza did switch hands a couple of times before then. I'm not really sure what the system that Egypt
So
administrated
before
looked like.
47, did Gaza actually existed? Did not. As
Well,
its
the
own
region.
territory did not.
The Gaza as a region? Yeah, of course it
I mean, but the Gaza, whatever the strip, did not exist because
The UN mandate.
as a
As
UN
a-
mandate, it did not exist.
Oh, you're saying as a political entity?
Well, you're talking about a political entity who's having trouble. So it existed either under Egyptian rule, a part of Egypt, or existed as its own, which it is now. So
now
but it's always been fed by the UN, is my point. And there was always been medical issues and all those kind of issues to get a valid perspective, and I think it's important to know.
I totally agree with you. So the literature that I can find doesn't go back beyond, let's say, I think the last one was 1982. But here's something, however anecdotal. Back in 1967, my grandfather was a medic with the Egyptian military in Gaza. And that's a lot of, the city was very, very prosperous. It's almost like Newport Beach of the Middle East, just saying much. Economically, it was very vibrant. And in fact, that's where he had most of his income from. When Israeli paratroopers landed, it was taking POW. When he came back, he said that Gaza had changed dramatically. a lot of the infrastructure had sort of failed. And here's the thing about Gaza and a lot of the things about besieged areas. In Iraq, when the war took on and the territory was taken over, then the U.S. had a sort of a UN obligation to take care of it, to sort of pick up the pieces. With Gaza, there was no one left to pick up the pieces because Hamas was still standing and the status quo was maintained. So I guess that's anecdotal data from me, but I don't have any real independent numbers.
I think it helps shed some light on her point to remember the fact that almost 90% of the Gaza population are refugees.
Yeah.
They were, you mentioned that in a way, but the fact that when you have a country or a strip or whatever, or a city whose 90% population are refugees, who are still looking to get back to their homes and lands, and who are living in miserable situations because of the things that have been going on. This summarizes the whole story. You are not talking about a country or a city that is in normal circumstance as far as its population is concerned.
No, that's a great point. Yes?
I'm wondering about, like, in social justice efforts and international relief, I think there's a lot of room for healthcare that there isn't the same room for, like, education reform or political reform or things like that. Can you elaborate a little bit more about the advantages relief efforts, health has in the relief effort arena, and how it can indirectly or directly address social justice?
Right. Another great question. It's very complex. It's very complex because there's more than one player in the Gazan territory. When we were walking down the street, that main highway, we saw a lot of sort of graffiti in Arabic. And I was telling the guys, who's this group and who's that group? Are they different wings of Hamas? They said no, these are sort of groups that are on their own. And certainly after we left, what you guys remember in the news, the sort of the Al-Qaeda that was in Gaza, tried to establish an emirate, and then Hamas came in and pitched battle. What I'm trying to tell you is it's very difficult at the top, because it all depends on who has the aid and how is it being distributed. If the aid is coming under the auspices of the Arab Medical Union, then yes, there's a lot of room for social reform and social justice, because now it's being given more or less impartially. If you're giving it in the hands of a government entity or another group operating inside Gaza, then I would think that it would destabilize things more. You want to know what the most important health relief item is to Gaza right now? Actually, two things. Not medicine or healthcare, anything, just two things. Concrete and steel. That's it. You do that to build the infrastructure, again, you will get to that big plateau in the very beginning, where you establish a good running water system and a decent built environment. That's what Gaza needs.
If I may, who is besieging Gaza right now? It's kind of understandable to have the Israelis besieging Gaza. But my question to you, since you've been there, how do you evaluate the efficiency of the siege that is underway by Arab countries?
Right, so Gaza is bordered by Egypt on the south. It's the only other Arab country, right? It's almost the same, minus any of the military actions. Right, so the gates are sealed. There's more order with how things are moving from the Israeli-Gazan border than there is at the Egyptian Gazan border, simply because a lot of groups from Egypt trying to get in there and provide as much relief as possible. There's a lot of physicians trying to get in there, so it does tend to get chaotic sometimes. But there are opening and closing times for the opening in between Israel and Gaza. Here's the thing, though: the things going through Gaza from Israel are nowhere near enough. It's barely enough to sustain 1/3 of the infrastructure, healthcare-wise. At least those are the stocks of medicines that we looked at, healthcare-wise. Whereas in the Egyptian Gazan border, there's a lot of things, and the administration is so poor in taking stock of what things need to go where and how these things are spread. So all in all, it sort of evens out. I mean, the siege is a problem for both sides. You still have to go through a lot of political hoops. The Egyptians have tried to accommodate us as much as we can because of tensions that happen usually around the Rafah Egyptian border. Some people say that groups from Fatah do come down there. I don't know. But there usually are tensions and riots that do just break out
But
spontaneously.
still, they don't have their airports operational
In Gaza?
their ports. Yeah. No airplanes can go
No.
inside Gaza. Okay.
No.
Why did you go through Egypt or Israel?
Well, Egypt would make more sense.
Yes.
Politically speaking, anyway. We had vehicles, emergency vehicles that we wanted to take into Gaza, but these were sort of confiscated by the Egyptians and said, we'll give them to Gaza ourselves, just not you. Because it makes a bad political statement on Egypt's sovereignty.
Eric?
I was gonna ask for with Israel's blockade, what's their official policy in terms of what they allow to come in terms of resources? Is it like a quota type system, or?
I really don't know. I can't speak on behalf of the Israeli military. What I do see on their website is that everything that needs to get in is coming in with the quota that they deem necessary, that they deem sufficient, and that's as far as that's the goes.
Okay, thank you so much. Are you willing to stay